Hello, everyone. My name is Joseph Muller, and I will be doing my infectious disease presentation on plague. Before we get started, just a quick overview of what I'm going to cover. I'm going to start off with the description of what plague is and give a little insight. Then I'll move to the case definition and how that's defined, as well as some of the control measures. And then I'll get into the incidence of plague in Miami-Dade County in the state of Florida, followed by the national incidents, and the last section will be for the forms on plague reporting. What is plague? Plague is an infectious disease caused by a gram-negative bacterium, Yersinia pestis. This bacterium is typically seen in fleas and rodents like rats, which are one of the main vectors for transmission. Plague can also be spread by droplet. This bacterium was known to cause many pandemics throughout the early 1900s, with the last being in Los Angeles, 1924. There are three different types of plague: bubonic, septicemic, and pneumonic. The majority of the time, plague is able to be spotted in the bubonic phase. However, if it's left untreated, it can progress to septicemic and pneumonic, which is where plague is able to be spread by droplet. The most recent case definition was from 2020. Some of the clinical criteria for plague include an acute onset of fever with or without other clinical manifestations such as regional lymphadenitis, septicemia, pneumonia, or pharyngitis with cervical lymphadenitis. As you can see here, there's different types or stages of plague, and these are seen to present different clinical manifestations. The very last clinical manifestation is for pharyngeal plague, which is typically seen in those with pneumonic plague due to the migration of plague from the lungs to the throat. Some of the laboratory criteria for the case definition consists of the isolation of the plague bacterium through culture identification, as well as either a bacteriophage lysis assay or a fluorescent antibody assay, which are both performed by the CDC or a lab response network. Or if there's a fourfold or more increase in the F1 antigen, a bedside test may be given, even though it's not recommended, and elevated F1 antibodies in a patient with no history of vaccination against plague. Or if there is a detection of either plague DNA or the F1 antigen identified through direct fluorescent antibody assay, immunohistochemical assay, or PCR. The epidemiologic linkage noted in the case definition was a person that is epidemiologically linked to another person or animal with a confirmed lab test within a prior 2-week period. Close contact with a confirmed case of pneumonic plague, which classifies as anyone coming within 2 meters or about 6 feet of a person with an active cough brought on by pneumonic plague. The third linkage is a person that lives or has traveled to a geography within the past 2 weeks where there have been confirmed cases of plague in fleas, rodents, humans, or other animals. A criteria to distinguish between new and existing cases includes multiple plague infections only should be counted if there is a new exposure with a new onset of symptoms. The final section of the case definition is the case classification, which is broken down into suspect, probable, and confirmed. Suspect cases are clinically compatible cases with the epidemiologic linkage mentioned previously. However, there is no confirmed lab test. Or this can be confirmed or presumptive lab evidence without any other clinical information. A probable case is considered a clinically compatible case with presumptive lab evidence. However, there may be no epidemiological linkage or alternative diagnosis. A confirmed case consists of a case with confirmed lab evidence or presumptive lab evidence with the epidemiological linkage. The first control measure is to prevent bioterrorism. It was noted that with the high virulence of plague, it has the capability of being weaponized for terroristic attacks, which was also noted to have previously happened. To prevent this, research into plague treatment and the use of antibiotics are two of the main ways to control this. Education and identification of plague for health departments and clinicians also plays a vital role in preventing a bioterroristic threat of plague. Some of the everyday prevention methods that can be implemented would be to remove debris that rodents may use to live in. Having this in places causes a breeding ground, not only for rodents, but plague as well. Another method is to wear gloves when cleaning up debris that may have had rodents living in it, and also wear gloves when handling any rodents. Insect repellent is another everyday prevention method that can protect against fleas that are known vectors of plague. In addition to this, spraying yards and around your home with flea repellent and making sure any pets have flea collars or a flea medication can also prevent the spread of plague. It is also vital to report any dead wildlife to the proper authorities, especially rodents, so they can properly be disposed of without placing anybody at risk of acquiring plague. The next control measure is reporting. With plague being a highly reportable infectious disease, it requires any medical provider that a patient visits to immediately report to the county health department. From here, the county health department must notify the State Department of Health Bureau of Epidemiology. From here, the CDC is then notified, and then the World Health Organization. All of this is conducted over the phone due to the urgency of the matter, as well as special forms that are required to be filled out upon reporting. Due to the dramatic decline in plague cases, thanks to antibiotics, there is passive surveillance system in place across the nation for human cases of plague. However, in states where there are still yearly cases of plague, many of those health departments have active surveillance for wildlife to track the prevalence of the infectious disease. The incidence of plague in Miami-Dade County in the state of Florida is 0. There has not been any cases of plague reported in the state of Florida since the 1920s, according to the Florida Health Department. As seen to the right, these are the prevalent cases in alphabetical order from Alabama to Florida. Prevalence was used in place of incidence due to the extremely low number of cases. Each year in the United States, there is an average of 7 cases of plague, ranging anywhere from 1 to 17 cases per year. Half of these cases are reported among those 12 to 45 years old, and was mentioned to be higher in males due to larger amounts of outdoor activity. However, it was not broken down by male and female. Again, due to the extremely small number of cases, prevalence of plague from 2000 to 2020 is shown on the right. Many of these cases are located in the Southwest, including New Mexico, Arizona, Nevada, California, and it was also mentioned to appear in Southwest Colorado. Here are the links to the Florida Department of Health Plague Reporting Protocol, the Florida Department of Health Plague Report Form, and the CDC Plague Case Report Form. Here are my references. Thank you.